Dr. Becky here. In this video, I want to talk about mindfulness meditation. Mindfulness meditation is the formal practice of mindfulness, and we'll talk in particular about seated meditation. So, in one sense, mindfulness meditation practice is very simple. You focus your attention on the present moment, and when your attention wanders, you bring your attention back. Now, it's not so simple to keep your attention in the present. So we choose an anchor, and an anchor is a focal point to help us be present and to have a place to bring our attention back to once we've wandered. So in most mindfulness practices, the breath is the chosen anchor. There can be others, but for our purposes, we'll go with the breath. And so you start your mindfulness practice, you're focusing on your breath, you're noticing the breath coming in, and you're noticing the breath going out. You're not trying to change the breath, you're just using it as a focal point. And then you'll notice at some point that your attention is somewhere else. That actually is a moment of waking up. There can be, interestingly, some period of time between as you're focusing on your anchor and between when you recognize that you're off your anchor. It can be a second, it can be a few seconds, but then you notice that your mind is someplace else. And so the instruction at that point is, without judging yourself or criticizing yourself, you just notice what has taken you away from the breath. Now, this is not a thinking about what took you away. It's not getting caught up in what took you away. It's just simply noticing what it was and then gently ushering your attention back to your breath. The next in-breath, the next out-breath. So over and over again, when your attention wanders, you notice and you gently usher your attention back. Simple, right? Well, not really, but in some ways it is that simple. So realize as you practice that you're not trying to make anything happen. You're not trying to feel a certain way. You're not trying to have a special experience. You are simply following the instructions. And the best way to learn how to practice is to do it sometime when you're alert, but maybe not so stressed. It's always easier to learn a new skill if you're less stressed. So you begin your practice of meditation by setting aside some time when you're less stressed. And what some of the things that help you do this practice are to have a quiet environment, someplace where you're not going to be disturbed. It helps to have a timer so that you are not having to watch the clock, and also so that you have a certain amount of practice. You want to find a comfortable seated position, someplace where you can sit upright, and you want to have this be comfortable and not rigid. You want to have enough space for the breath to move easily in the belly area. So a comfortable position, not one where you're likely to fall asleep. This is a practice in being alert. So you have a quiet place, you have your timer, you have your seated position, you have your focus of attention. Now, a lot of people like to have guidance when they're first learning. You can just set your timer and follow the instructions on your own. But if you prefer to have some guidance, there's some really good ones. You can look at YouTube, you can look at CDs, there are downloads. My recommendation for you is that you find ones that are specifically mindfulness meditation practice, since that's the kind of meditation practice we're talking about. And also that you look for ones that have an emphasis that's similar to the mindfulness-based stress reduction program. And part of the reason for that is that's where the studies have been, and the studies that show that mindfulness can be helpful for you. In future videos, I'm going to do a 3-minute guided practice and a 5-minute guided practice. So those are also options for you. So you start learning when you're a little bit less stressed. And then if it feels right to you, then you begin to have a daily or near daily or routine practice. And picking a usual time is the best way to be consistent about it. Now, the beauty is that some days you'll come to your practice and it will be very easy to quiet the mind. You'll find that it feels really comfortable and you feel at ease and you really enjoy it. And some days you'll come to your practice and you feel like you are wrangling your thoughts the whole time. And I use wrangling loosely because really it's a gentle bringing your thoughts in. It's not a rigid kind of strong arming your thoughts back to your focal point. But some days are like that. You're just more scattered and you have more pain or more emotion, or the things that draw you away are much more charged and it's harder to let go. So you might finish that practice and think that it wasn't helpful, but that practice may actually be more fruitful to you in the long run than the practice when things were going really well, so to speak. Because remember, you're not trying to have a special experience. You're learning about how to bring your mind into the present, how to center yourself, and learning how to do that when your mind is more active during formal practice is going to be an enormous help to you when you're in these stressful situations and you find yourself really scattered. If you can find that coming back to the present during those experiences, and you can find your quiet place and you can find that space, you're much more likely to be responsive rather than reactive. So practice day in and day out. As far as time goes, you might start with 5 minutes. This is enough time to actually get you into some more active practice, but it's not so long that you're going to lose your focus. Once you feel like that works pretty well for you, if you want to, then you can expand that to 10 to 20 minutes. There is some research that says a longer practice period, especially if you can stay true to the practice during that time and not just drift off, then it is more effective for you. So you do what works for you. Now, for somebody who has a bipolar condition, a emotion regulation problem, or PTSD, you might find that when you first start learning mindfulness that it can be just a little overwhelming for you. So my suggestion is to do like a minute long practice to begin, and also talk with your therapist about mindfulness to see what they have to say about any guidance for you about how long to practice and how to integrate mindfulness into the other kinds of techniques and things you're learning in therapy. Now, if you have an ADHD condition, you may be like a lot of people that I hear say, there's no way I can practice meditation because I can't focus. Well, interestingly, there's a lot of studies, and a lot of them come out of UCLA, about how mindfulness practice can actually strengthen the focusing and concentrating muscle, even for people with ADHD. And it is a recommended treatment. Now, we're not doing treatment here, but mindfulness can be therapeutic. And the point I'm trying to make is that even if you have an ADHD condition, mindfulness can be helpful for you. So, but for you, you might want to start with a shorter time frame. So you want to find your quiet place, your comfortable position, your timer. You set your intention to focus on your anchor, whether it be with guidance or not, for your time period. And then when you're done, you give yourself the opportunity to be grateful that you've practiced, and just know how important that is and how helpful that can be in your everyday life.